Listening to podcast is no replacement for real training. While we attempt to provide accurate commentary, we hold no responsibility on how you use the information we provide. Get medical training. In the blink of an eye, everyday order can be replaced with once-in-a-lifetime chaos. Be prepared. This is the Civilian Medical Podcast.
Hey guys, welcome to another episode of Civilian Medical Podcast. Hope you didn't forget about us. We didn't forget about you guys, but we're here to record episode 27. Super excited about it. We're going to answer some of y'all's questions that we both posted. Sean and I both posted. I got my co-host here, Sean. I guess I said that like I'm the star, but I'm not the star.
No, you are the star.
I said that. I'm like, that's super awkward. He's not my co-host. We're both doing this. But we posted it on our Facebook page and said, what are some questions you guys want us to answer? So we took some of the good ones and some of the not so good ones, and we're going to talk about them.
There's definitely some not so good ones. You said we didn't forget about them, and I'm over here like new podcast. Who dis?
Yes. Like, what are we doing again? We haven't seen each other
in a couple of weeks at least.
I know we've been traveling and busy. So,
although we're recording like 3 of these over the next 4 days.
Yes.
3 days. 1, 2, 3, 5, 4 days. I don't know. How does math?
Technically, as we're recording, it's a Friday, and then we have 2 episodes back to back on Monday. We're going to record, and so we should be a couple weeks ahead going into the holiday season. So while everybody's traveling for Thanksgiving and to Christmas, you should be able to listen to our podcast.
Exactly. Maybe we should cover like turkey-related injuries.
Maybe we should, like gluttony and like what happens if you've got heartburn or you got the poopers. Yeah, we could talk about that. We should do that.
Yeah, actually, we should record 2 today. Anyway, we'll figure that out. But there are some great questions. Some not so great questions came up as well. Like, please explain why pants are the bane of human existence. I don't really feel like that's something that we could cover on this show.
Yeah, like I wear pants all the time. Honestly, like I have chicken legs, so I normally do cover them up with pants. So I wear pants a lot.
Oh man, I'm actually not wearing pants right now. So
just don't move the camera down. We'll be fine.
Yeah, everything got awkward. I hope I don't get up and go get a drink or anything. All right. Well, I guess let's just start it off. Why don't you take the first one?
Yeah. So the first one was talking about mental health, both for coworkers and civilians. And this is kind of something that I've kind of been on my mind for at least a couple of years now. We've been more and more about it. We're first responders talking about, the stress of the job, PTSD, the things we see. So when I taught EMT years ago, I used to say, look, it's a video game. You have all the rules. You'll win some, you'll lose some, and you have to play like a game, and you can't get emotionally connected to these patients, these people. And while that's still true, some sort, it still bothers you, like still holds on. Like kids really bother me, like traumatic injury for kids, like that really bugs me. And it sticks with me. But you have to be able to now figure out how to get rid of those ghosts. And talking about it is huge. Talking to other people who've been through it, or someone that can help you walk through the mental health process is important. Just holding it in of what you're dealing with, the emotions that you're dealing with, the anger, the sadness, holding it in does no good for anybody. So now, like I really try to make sure that, especially if I'm on the call and it's a bad kids call, a couple of things is right after the call, I sit down with everybody, the back bumper, the ambulance, the firefighters, the cops, whoever there, and we just do a quick hot wash. All right, this is what happened. This is what we did. This is, blah, blah. And you just kind of let everybody talk. And then usually a couple of days later, we circle back to it. More of like a formal setting, like at a table with coffee, and we sit there and we talk. All right, how's everybody doing? Are you having bad dreams? Are you still thinking about it? Like, this is what went really well on this call, or maybe this is some things we could improve for the next time. So to be able to talk about it is super important. So I mean, I've had calls I knew happened, and I couldn't make it to the call. So like I go meet the crew at the hospital. I'm like, hey guys, let's talk about this call, and let's talk. Like, just make sure everybody's cool, make sure everybody's good. So that's important. It really kind of like a couple years ago, I was full, and I say that like emotionally, like I'd had enough. Really want to get out of EMS altogether. Like I want to just go work at Walmart. And someone talked to me and like, dude, you're not right. You're mad, you're angry, you're emotionally, you're not right. So talking really helped, and kind of realized, this is going to sound super egotistical, but I'm a good paramedic, and that people still need me. And so that's why I do what I do, because I'm a good paramedic. I'm really good at it. I'm not good at anything else. I'm not good at making YouTube videos. I'm not good at running a business, but I can be a paramedic. So that's what I do. So talking about it really helps.
That's huge, man. Yeah, that is important. See, I just repress everything down deep and don't talk about it. But for me as a civilian, like not a first responder, I don't see that kind of stuff every single day. I don't see that stuff very often at all. And when I do, it's usually extraordinary circumstances, or it'll be someone like going into a diabetic shock or something like that, or but for civilians, we see those things and we deal with it like I think we deal with everything else in life. You don't spend a whole lot of time talking about it or your feelings and stuff. And I think what you just said is pretty huge, and I think really important for people to think about, especially if you're a civilian and you come across something bad and you do some good work, you help a little. Maybe they continue on in life, maybe they don't, but definitely maybe talk to somebody about it. I wonder, are there any resources for civilians who have to deal with stuff like that besides like, using your insurance and going to see a counselor or something like that?
I don't know the answer to that. Like, there are a few people that I'm aware of. Like, there's a lady in Texas, I can't remember her name right offhand. And then we have one local here that are psychologists / paramedics. Like, they were paramedics first, and now they're psychologists. They're mental health people. So that's huge for us, is that somebody who knows what happened on the call, knows what happened, knows at least an idea, and can walk you through that mental health. And for first responders, it's generally not as bad because we don't have that emotional connection with the patient. This is, for example, a 25-year-old at Rex. Like, all right, I didn't know her, I didn't know him. I do what I do and I move on. But for a civilian, it may be somebody that like it may be a coworker, it may be at the range. Like you were saying, the gentleman that you helped with the diabetic issue, you know him, you know his name.
Mm-hmm.
So that makes it a little more difficult, because you already have that friendship, that connection there. So if something bad happens at the range, then these people. So that can make it tougher.
Yeah, for sure. So I guess the key here is talk about it. Talk with somebody. Have a friend, and if you don't have anyone to talk about it with, and you're honestly struggling with it, first off, like reach out to us on Facebook or something like that. We'll listen for a bit. But if it's more critical than that, don't forget the suicide hotline 1-800-273-8255, or you can text 741-741. Like, don't let it get to you. Don't let it become your problem. Talk if you need to.
Yeah, definitely. If anybody's struggling with that right now, send us a message on Facebook. We can work on getting you connected with somebody. Like I said, I don't remember the lady's name, and she was on a podcast recently. I was listening to another podcast, a first responder, and she was talking about, she's a mental health counselor, stuff like that. So we can get you some help. Just let us know.
You dirty tramp. You listen to other podcasts?
I do. I do. It's terrible.
Ridiculous.
I even listened to this really crappy one called We Like Shooting. Like, those guys are super shady.
Why would you though? I don't even understand.
Sometimes I'm bored.
It's a terrible idea. The next question is kind of related. What are some techniques you use for your psych patients, suicidal and or homicidal patients?
So the biggest thing is just talking to them. Most of the times when I talk to, you give them a ride to the hospital. Like, they don't need any kind of, they don't need anything. They don't need an IV. They don't need medicine, things like that. They just need somebody to talk to. We've all been in bad places, and mentally, one point in our life. Some people just can't figure out how to deal with it. So I usually just listen, let them talk to. I don't mind it. It's an easy report for me. Like, as far as being a first responder, it's just easy, just to ride the call, take their blood pressure a couple of times, and let them talk to the hospital. Let them talk.
Yeah, and I will say that takes a huge toll on a person's psyche. One of my friends that I play hockey with, years ago, he called me literally standing, not just on a proverbial cliff, but literally standing on an actual cliff. And, I talked to him for a long time, a couple hours, and it was extremely emotionally draining on me. And even to this day, when I think about it, I still feel that drain on me, and I still feel like that time. And I probably am not the best person to call in times like that because I'm reasonably pragmatic. My response wasn't like, "Oh, come on, you've got so much to live for." My response was, "Are you that effing selfish? You've got two daughters that rely on you. Are you so selfish that you would leave them without a dad for the rest of their lives?" Well, in that case, it actually worked. He's still out there today and still kicking butt and taking names. But man, I'll never forget like how drained I was. I immediately went to sleep because it was at night, so it wasn't like it was absurd. But I slept for like 12 hours straight. I was wrecked. Because I knew I was like, if I say the wrong thing, like he's gonna die, and I'm gonna have to live with that.
Yeah, it's tough, and I see both sides of it. I really do. I see the side that what suicide is extremely selfish. You've got a wife, you've got kids. I'm definitely going to be there to walk my little girl down the aisle and see my little boy get married, stuff like that. So, but I get it. Like sometimes we're just full emotionally, psyche wise. You're like, you know what? I can't do it anymore. Screw this. And so I get it. You've seen a lot of stuff. You've done a lot of stuff, and you're like, I'm done with this. But there again, having someone to talk to, like I said, it can be super stressful on both ends, especially you got somebody like I say this in trying to be politically correct, I guess, but most of the time that when people call 911 for suicidal ideations, like they're thinking about it, they're not really going to do it. They're just reaching out.
Yeah.
The people that you're like, you find them like they're dead, like they hung themselves or they took an overdose or shot and killed themselves. You're like, oh, they really meant it. Like they wanted to do it. So, I'm okay with, reaching out for help, obviously, but most of the time it's like, all right, they're just looking for attention because we see the same patient going every other week or every 2 weeks, once a month to the hospital because they're thinking about killing themselves. So, you have to be careful because, obviously there's times where people are in a bad spot and they need help. So you just let them talk and give them a ride to the hospital. I would think for safety wise, always make sure they don't have any weapons.
Yeah.
Because if someone is suicidal, they don't have a problem taking you out with them. So if you are going to try to talk to them, disarm them. And I've been there. I went to buddies' houses that were in a bad spot and said, you know what, you're not going to get, I'm going to keep these toys for a while. And I take the guns from them. I've done that before. And I'm like, when you're in a better spot, you can have them back. But you're not going to do this to me.
Yeah. Several friends that I have had people in their families that got that and went to their houses, took all their guns out. And when everything was good to go, they gave them back. And I thought that was important. It was tough for them, right? Like we're not their parent. We're not there to like manage them and boss them around and tell them what to do, but they recognized that something was going on. They went and they did something. I think this would be a fantastic for us to get a guest on to maybe talk specifically about this topic.
Yeah, I
maybe
think
even a couple shows.
Yeah, I think so. Like, because these aren't quick, easy answers to talk about. So
no, and definitely don't do what I did. It worked in that situation, but I had a good understanding of the person that I was talking to and their psyche, and he's a dear friend. And
yeah, and don't tell them that they're just looking for attention either. Like don't do that.
Definitely.
But sometimes these people just want to talk. Like they just want to listen and to get it off their chest. But make sure safety wise that you're safe, they're safe, and let them talk.
Yeah, it's first thing, scene safety. Figure out what's going on. Understand.
Definitely, but I think we could do a couple episodes on this topic.
We should. I think I've even got some people in mind that we'll bring on as guests. So yeah, stay tuned. We're going to do full shows on this because I think this is actually important. And we both have been in spots where we had to work on that. So yeah, we'll circle back around to this with a full episode. What's the next question / topic?
So said how to spot a coworker in need and what we can do to help.
Man, I think we leave that one for the full show.
Yeah, let's skip that one. Let's do common industrial and home injuries. Most of the time I've found like industrial seems to be like big machinery stuff. Like I've seen some crushings, some nice lacerations. They do have a lot of safety equipment on those big, the presses, the cutters, and stuff like that. But usually they have very strict and high safety standards. And usually it's when someone has bypassed a safety standard that they get cut. I've seen some machines that, cut, and then if you stick your hand in there, the laser breaks the barrier and the machine automatically cuts off. or there's a shroud or something, a shield that comes down, and people bypass that. And so usually industrial accidents can be pretty gruesome as far as what happens. If you're dealing with chemicals, things like that, that's a whole nother area. If you're chemical cleaning, things like that. But home injuries, like I just think those are typically like the boo-boo type stuff, but mostly like those need the My Little Pony band-aids. You maybe get some fractures, stuff like that, some sprains, but most of the time home injuries are going to be like the lacerations that you just need to put a band-aid on and take care of.
Yeah. So when you're talking about like homeowners doing upgrades to their houses and things, it's going to be cuts, a lot of cuts. It's going to be just the other day, actually, I was helping a buddy put up some drywall literally within the last week. He is EMT. So we were pretty squared away. However, it was a reciprocating saw, and he actually had his hand just up a little bit too far. So as that reciprocating saw started, it literally popped back and like popped his finger. I mean, that is like, talk about
so close
things. Yeah. But it popped the skin. He bled a little bit. He didn't even like cuss. He just walked out, took a little bit of a walk for a minute, and then he taped it up himself and continued on. I was like, I would have literally screamed like a girl and made you call an ambulance. But he handled it well. It's still like, it's been a week now. It still hurts every single day. He had to drill a hole in the nail to relieve pressure. And
oh yeah.
The other day it was oozing, and yeah, but kind of stuff like that.
I would have went outside. Like, I gotta go drink a beer. I'll be back. Like this is require a beer.
Exactly. I'm pretty sure that we actually did drink a beer.
Just your fingers like so close to getting chopped off, like the end of your finger, like that would not end well.
No, like maybe slipping and falling in a bathtub with possible, I don't know, spinal stuff.
Yeah, like we see a lot of like elderly patients who fall, and that's kind of the thing now you're seeing with EMS is like when we go into a home, I'm always trying to look around, especially like the elderly's house, to say, look, you need to pick these rugs up, move the rugs, because you're gonna trip and fall on them. That way, if I feel like if I can prevent the old lady from falling, it saves me a call. Usually like 2:00 in the morning, I'm like, I don't want to get up for old lady who's falling. I'd like to sleep. So if I can save that call, we'll do it. So, looking around, just like, especially, we're going into holiday season. So when you're around family members, look around, like look for rugs that may cause grandma to fall.
That's good.
Make sure grandma's wearing good, either like shoes all the time or like the slippers that have the grips on them. Make sure grandma's not wearing her socks around all the time, because they'll slip and fall with the socks. And kind of look around, make sure there's no cords for them to trip on. And just while you're doing the holiday season, just kind of look around your grandparents' house and see if you can prevent some injuries.
Yeah. And let's circle back to industrial crush injuries. When you see a crush injury, we'll say like arm, kind of what are the things that you personally look out for? What are the possible repercussions of a crush injury, and what are maybe some treatments that civilian medics can do?
So you have to worry about bleeding, of course, and sometimes you may not be able to see where the injury is bleeding from, depending on where the crush is coming from. But a lot of times you need someone in there that can disassemble the machine or the part, whatever is crushing them, because we just can't pry it open sometimes. There's so much force. So you got to have somebody who knows what they're doing to start taking it apart, keeping the patient calm and taking their vital signs, maybe doing rehydration, getting fluid on board. And some pain management would be nice. Obviously, civilians would probably don't have that kind of stuff, but have an EMS there to start giving some pain management, because this is going to be depending on how extensive the crushing is, it's going to be could be long term that we're having to deal with this, get the patient out of the machine or something like that. You have to worry about like acid-based stuff too. They can get really acidotic, the extremity, because the blood flow is not moving. Basically, they do have a limited blood flow in that arm or the leg or wherever the crush is at. So, and then you have to be careful, depending on how much is crushed, what's bleeding out. When you go to take that machine off, freeze the machine, you could actually lower the blood pressure too much, and they could die on you. So, you have to kind of be prepared for that. We try to, especially if it's like someone's trapped, like the whole lower body, then we're going to start IV fluids. Maybe have some bicarb ready to go, like trying to prevent that when we got to release that we can compensate for them maybe like a junctional tourniquet or something like that we can put on it. But I wouldn't be afraid to, go ahead and if you have an injury you can't see, and you've got like, if you can't see the arms, can't see the leg, you got your vital signs are, like a high pulse rate, low blood pressure, I would be concerned about bleeding. So I wouldn't have a problem going and putting on a tourniquet, even though you can't see the injury. Your vital signs are leading you to think this person's in shock for whatever reason. So if you can stop the bleeding, even into the machine or whatever crushing is going on, then I would do it.
Yeah, compartment syndrome is definitely
Yes.
something to think about. You want to remind people what that is?
So yeah, that's where that was. We're seeing swelling around the extremity, loss of blood flow to the extremity. So that's where you're seeing acidotic, and the free radicals are building up, and you could very easily lose that extremity from a compartment syndrome.
Yeah, and that can be like a bookcase falling on your arm or something. That's actually a specific example I had from a class. Someone was like, yeah, my wife, like a bookcase fell on her arm and she had compartment syndrome and we didn't realize it right away. So definitely something to keep in mind.
Yeah, I ran an elderly lady one time who fell and landed face down, and her arm got tucked up under her. And she was so weak and that she couldn't move. And she laid there, unfortunately, for a couple of days until somebody came and checked on her. And when we rolled her over, her arm looked awful. Like it was blue. You could tell it looked dead, to be honest with you. And yeah, she ended up losing her arm because she laid on it for so long, just no blood flow for a couple of days. So it can happen. And so just, make sure we're reaching out to our parents or grandparents. And like I said before, when you're going through the holiday season, just try to look around and try to prevent injuries.
Yeah. Either way, make sure you take that overall holistic look at the area and, make sure that you're going to be safe. Make sure whatever the source of injury isn't going to cause more injuries to them or you, and take care of that. Literally the first step in all the classes is examine what's going on around you.
Definitely.
Altered states of conscious scenarios.
So did we cover this in like one of the beginning episodes? Like I can't remember.
Yeah, we did.
So and that's there are a lot of things that cause altered mental status. This could be a blood sugar problem. It could be a head injury problem, a blood pressure problem, a stroke. So there's a number of things that can cause altered mental status. So you got to kind of start figuring out what it is. Maybe they're hypoxic. They don't have enough oxygen going to them. So kind of use some of your tools to start assessing the patient and figuring out what's going on, looking for bracelets, see what kind of medical history they have, asking, around, like, do you know what's kind of medical problems this person has, and start working your way down to figure out what's causing them to be altered.
Yeah, 100%. And that's in one of the very first episodes when we were covering March.
Yes.
That is probably in the H for heat loss and head injury.
Perfect. So if you haven't listened to those beginning episodes, I would go back and listen to them again.
Yeah, listen to them like every 3 months.
Yes, perfect. That way, if we miss a week or two on recording, you just go back and re-listen to it, and you're like, oh, we didn't miss us.
Absolutely. What's the next one?
So what emergency services want to know when they arrive on scene?
Now, I can tell you this, like when I'm in classes and teaching, I'm like, yeah, keep track of when you put on a tourniquet and kind of what happened, what are the injuries, what did you find? But my guess is in real life and in my experience, when you guys show up, like it's not really a thing that, I mean, you want kind of like maybe a quick turnover, like what's going on, but you guys are getting down to business. You got your bags ready. How much information taking do you take from a person who's rendered aid?
Yeah, like personally, I want less than 30 seconds. Like don't drag it on. Like I'm just not trying to be a jerk about it, but don't, like I'm probably gonna ask the same questions over again, to be honest with you, just to kind of make sure we're all on the same page. And they may tell you one thing and tell me something totally different. So it kind of works. So give me, when first responders arrive on scene, give them the quick down and dirty. All right, grandma fell, she's hurting in her right hip. Okay. Or they hit head on. This guy was completely unconscious when I walked up to him. He's kind of awake now, but kind of what you saw, or hey, this guy's got a gun. Like that I'd appreciate that. Give me a heads up on that. But just something real quick, down and dirty. Don't run away when you first get there, because I may come back to you and say, what did you say about that? So we typically ask for a sample history when we're interviewing a patient. So that's signs and symptoms, allergies, medications, pertinent past medical history, last oral intake, and the events leading up to whatever happened. So as I start going through that, I may have some questions for you just to kind of bounce back to make sure we're good to go on what is happening with this patient. So when first responders arrive, just kind of give that real quick down and dirty, like this is what happened, or she was unconscious, or hey, I put this tourniquet on 5 minutes ago, or things like that. Just 30 seconds or less.
Yeah. They don't want to know what pulse you took and the stuff like that necessarily, because they're going to do all that themselves. Like you guys have a process that you go through and you do it every time.
Correct. If you did take a blood pressure and you're like, look, Dietrich, her blood pressure was like 200 over 110 when I got there.
Yeah.
Okay. Like that's something real quick. Cool. I'll double check in just a second. Or you're like, hey, I couldn't feel a radial pulse. I think it was like 40. Okay. Perfect. Like that's just something real quick, a couple sentences to let me know what's going on with this patient, and then we'll figure it out. But just don't run away from me either, because I may come back going, did you say that guy was unconscious, or did you find this? So I may have another question for you.
Yeah. I think that's pretty good there. Evidence-based medicine. Ooh.
Yes. Oh my gosh. There's so much drama around evidence-based medicine.
What is it?
So in the past, we have been terrible about just doing stuff because we've always done it that way. Whether it be CPR or medications that we give or whatever. We just always did it that way. So we're going to continue to do it that way. So now there are a lot of research that goes into what we're doing. And now they've figured out some of the stuff we're doing wasn't very helpful, or it could have been, dangerous to the patient, or there's something that works better. So there's from research. So we kind of have to use that. The thing is, like with the trauma stuff, like we take the TCCC committee as the gospel. And if anything doesn't fit in that, you're like, all right, there are people who say that we shouldn't use it. I'm like, all right, well, that's perfect for 18, 19-year-old fighting age men and women. But there's stuff that we deal with, 45-year-old man or 85-year-old man with high blood pressure, diabetes. So there's other things out there that they don't really take into account for the committee. And so looking at that kind of research and seeing, what works, what doesn't work, and kind of choose what's the best practice. One of our upcoming episodes, we're going to talk to a friend of mine who works for American Heart Association. They're really big on, working with evidence-based stuff about CPR and things like that. So we can talk about more of that in episodes coming up.
Yeah, very cool. And I mean, it's kind of like, for me, it's really common sense, right? Like I want to do the things that there's data that show that those things work. But as with any data set, it's going to be missing things, like you just said. So when I see a new product on the market, I'm like, okay, well, I am not going to put that in my bag until I personally have enough experience with it that I would trust my own life with it. And I saw that with a tourniquet that came out at SHOT Show this year. And it turned out to be really freaking bad. Like that thing is awful. I don't even remember the name of it, or I'd call it out, but
I don't remember. I saw videos of that thing on Instagram. Like that was, people were breaking them right at the show.
We broke one.
Yes. So
yeah. That was no, not that one. It was like that. It wasn't even a ratchet. It was like a thing. It was a hinge that you had to pull over. Do you remember that one?
I don't remember. I remember, but I don't remember the name of it.
I think it was from Zero Delta. That one, I broke mine like in 3 minutes just trying to put it on. And
yeah. So, don't be the first one to jump on the new product. Like get some people who've used it. I like doing that. Like if I have a product that I'm looking at, I will post in a couple of groups that I'm in, like Facebook groups. Hey, has anybody used it in the field? And you will generally get somebody who goes, yep, I've used it, love it. Or no, I used it a couple of times and had this issue with it. Or, if I've used it in the field, I can come and say, yep, we had great, it was good, squared away. So, ask around. Don't be afraid to reach out to a couple of people, that are in the field working. And so what do you think about this tourniquet? What do you think about this hemostatic agent? Or should I even use hemostatic agents? Do I need an MPA? Do I need chest seals? Like, don't be afraid to ask questions and do what you think is best for you.
Yeah.
Your family.
I will say one bit of colloquial knowledge that I had heard was that SWAT T, like you can't use them if your hands are bloody or whatever. So I decided to test it. And if I have gloves on, like it doesn't matter how much soap or liquid or slippery crap that I put on my hands, I can put a SWAT T on. Nice. And I repeated it many times. I was like, no, you can't do it. And finally one day I was like, you know what, let me actually test this. And I was actually kind of surprised that the gloves and the SWAT T kind of stuck together pretty well no matter what I was pouring on my hands. And I had someone literally just pouring soap on them the whole time I was putting on the roast that I was working on. And so I kind of changed there. But yeah, I mean, don't take everything as gospel. Don't even take everything we say as gospel. Like if you have a question about something,
Definitely don't take us.
No.
Definitely don't take what he says the gospel. But yeah,
Try-
like the SWAT T is a great example of that. Like the TCCC is not on the recommendation list for the tourniquet, and it's because it's not designed for one-hand application. It's not saying it's a bad tourniquet. It's fantastic for kids and for dogs or canines, and it would work. I've not used it in the field. I've talked to people who've used them in the field, and they worked. So to say that it wouldn't work, I don't think it would. So it's a wide pressure bandage. It works good.
Yeah, and that's what I'm like. I like to carry things that I can use for multiple things, and I could possibly use that as a backup tourniquet, but I can also use it as a pressure bandage. I don't know, like I could hold a hot or cold compress on somebody with it. Like they have uses outside of what their primary function is.
Definitely, and that's what I like. I probably wouldn't I wouldn't recommend someone using unless it just was a financial issue, but I wouldn't point them to that being a primary tourniquet. But it's a great backup. It's a great, like you said, it's a pressure bandage. It can hold a splint in place. It can do a lot of things. And it's 13, 14, 15 bucks, something like that. So it's reasonably priced.
Yeah, for sure. What was the next one?
So how to help a first responder at the scene without getting in the way. And
You basically just laid it out.
yeah, like you got like not being a jerk, but yeah, you got to get out of the way. Like when first responders get there, it's time for you to step back.
Yeah.
I appreciate your help, and I may ask for your help. Like if I'm there by myself doing CPR, like I'm gonna ask you to do CPR and help me. Or if I need you to open up a package, like I've done that before. Hey, my hands are bloody. Can you open this up for me? But do kind of take a step back and kind of let first responders in there. If they need your help, they'll ask, and hopefully they're not jerks about it. But if they are, just let me know, and we'll call them out. So
yeah. I was present. Excuse me. I was present at an overdose, a pill overdose, and when first responders got there, I was like, "Here's what I saw. Here's what I did." It was like 10 seconds, maybe. Then I stood out of the way, and I was like, "Do you guys mind if I just stand here and observe?" And they were like, "Yeah, it's totally fine." And that's what I did. And they didn't really ask me anything else, but I was there if they needed me. Like you mentioned, don't go too far away, but stay out of the way.
mm-hmm.
I stayed there. I stayed out of the way. I made sure I was very cognizant of what they were doing and what was going on with them. And literally, when they walked in, I had an MPA in my hand. I was getting ready to put it in. And the first thing they did was put an MPA in. I was
Perfect.
Like, if I'd have just been like 10 seconds faster, I could have got the application.
Slow poke. You got to get it in there.
I know, man. I know.
But bad. You could, if you're at a house or something like that, start moving things out of the way for first responders, like move chairs, move things so they can get the stretcher in there. Typically, they will not ask you to help lift or move anything just because it's a liability issue. Like if you say, "Hey, I can help you get the stretcher," I'm probably not gonna let you do that because if you hurt your back, you hurt yourself, then I'm gonna be in trouble for that. So, but you can move stuff out of the way, like move a coffee table out of the way, move a couch, like kind of so we can get better access to the patient.
Yep, 100%. Next up is pediatric emergencies, please.
Yes.
This is all you.
So I think there again, we could do another episode or two at least just on pediatric emergencies. Most of the time, thank goodness, they are very minor injuries that happens to little kids. You can talk to them. I love dealing with kids, honestly. Adults lie to you, and it pisses me off. But little kids are honest with you. They're like, "Yes, I hurt." Okay, you hurt. Or my throat hurts, or my back hurts. My arm really hurts because I have 2 elbows now. Like they're honest with you how they feel. If they've been in a car wreck, you're like, "Hey, do you hurt anywhere?" "No, I don't hurt anywhere." And the mom says she's hurting 4 places in her neck and back. I'm like, "Come on, are you really hurting your neck and back?" Like kids are honest, and I appreciate that. And kids are either sick or not sick. It gets pretty easy. Kids are usually, by the time first responders see them, they're either nothing's wrong with them at all and the parents are freaking out, or the kid is getting ready to die, and you got to act quick. So I definitely think you could do a full episode or two just on pediatric emergencies. But think about minor injuries for them. We keep toys in the ambulance for kids. That's another good thing to think about. Just putting a little stuffed animal in your car to give to a kid that's been involved in a wreck, things like that. Seizures, febrile seizures are big with kids, meaning that they've been sick, like snotty nose, cold symptoms, and all of a sudden they spike a fever really high, and they'll have a seizure, and that breaks the fever. So typically they're fine. They may be sleepy or tired by the time we get there, but mom and dad are freaking out because little baby Joe just had a seizure, and they think he's going to have seizures for the rest of his life. Like, no, he's fine. He probably will never have another seizure again. He's good. Seizures are big. Those fractures, dislocations. Remember that kids bounce. So if they do break an arm, break a leg, they've got pretty significant mechanism to do that. Maybe they jumped off the house, they jumped off the trampoline, something crazy. But typically their bones are still pliable. They still bend a little bit. So if they actually do break a bone or a leg or an arm or a leg, something like that, it's a pretty big impact.
Yeah, definitely. What about children's vitals? How are they different from adults?
So their blood pressure is going to typically be lower than adults, maybe around 90 systolic being the top number, maybe a little bit above that. And maybe their pulse rate, depending how small they are, an infant, things like that, their heart rate is going to be higher. The respiratory rate is going to be higher. So just kind of anticipate that. Don't freak out if you've got, a 1-year-old and the heart rate's 110, probably, they might just be excited, things like that. But their heart rate can run higher and their blood pressure run just a little bit lower than adults.
All right. Excellent. Good to know. But yeah, peds, that's another great one. Like maybe an ER doc or something that specializes in peds. I'm sure you know somebody.
Definitely. Let me see if I can reach out. That'd be cool.
All right. Awesome. Let's talk about training. Well, we got a couple questions on training. You want to start out on those?
Yeah. So it says, what should someone look when picking a training class? And then someone's want to know how to find good training. This is tough.
It's really tough.
Especially in the Instagram. We'll keep picking on Instagram world. But everybody's an expert and everybody's looking to make $1. And it's not all training is created equally. So for me, I look at their background. Like I want to pull their background, see what it is, see what they've done for a living, see what kind of education they've done, what kind of classes they took recently, because I want to find out they're doing they're keeping their skills up to date too. So I want to say, what classes did you take this year?
Yeah.
And kind of talk to them. And I obviously talk to people who have taken the class, who can recommend this company, this group, this person to take a class from.
For sure. For me personally, when I'm researching stuff like this, and this goes for medical training, firearms training, whatever, I like to read reviews and I immediately eliminate 5-star and 1-star. And I kind of go for somewhere in the middle, 2s, 3s, 4s. But I also like to read, I don't want to know like necessarily about it's the best class that I've ever taken. It's wonderful. Cause I literally know people that are awful, and they get great reviews. And I literally, I'm thinking of like 3 specific individuals in my mind right now. They get great reviews. People just gush, but they are awful. And I like to read reviews where they kind of talk about like, what is the teaching style? How do they relate the information and how did that affect the person as a student? Like everyone I think can always improve 100%. But that's the kind of stuff that I look for. Like I look for reviews specifically that talk about like, this is kind of what they did. This is how it related to me. And this is what I got out of it. So if someone doesn't really have any reviews or you can't find more information on people who've taken their classes, that's usually a good indicator that people don't care enough to leave reviews. Like I've heard excellent things about Skinny Medics classes. Excellent things.
Nice.
And you can find that out there. And I had people take my class that took your class and literally they gushed about your class and how great it was. And I thought that was awesome. I'm like, yes. If one of your buddies is taking a class from a person, like ask them and don't let them like snowball you. Wait, don't let them snow you. Snowball different. Don't
That's like different.
Don't let them snow you. Like actually ask questions. Like, what was something that they taught that you didn't know that really kind of made an impact on you this many months or years later? Try to find out as much as possible. And yeah, interview them a little bit if you have to. If they won't answer the phone, usually a good indicator. Or, I mean, I don't answer the phone, but if
I don't answer the phone either. Don't
ever.
But I do email. I do answer emails. Like if you email me, I will answer. It may take me a day or 2 to get to you, but literally the shop phone will ring and I don't answer it.
Yeah.
Like I make Lindsay or someone like that. They'll answer it. They'll talk to you, and like Lindsay will say, "No, he's not in the shop," and I'm standing right there.
Yeah, and you're giving her a high five.
Yes, I'm like, all right, I'll go buy you coffee for that. I appreciate it.
Yep. But yeah, just like try to figure out people who've taken their classes, talk to them a little bit. finding good training is really knowing what kind of training you're looking for, right? So do a little bit of research yourself and understand what your goals are, and then try to find training that meets those goals. If you want training for traumatic incidents, a CPR class isn't going to be your best choice. You should take a CPR class, but take both, but figure out exactly kind of what you're looking to accomplish, and that'll help you better look through the class syllabus and figure out what they're going to teach you.
Definitely. And like for me, like I still take medical classes all the time, and I try, especially if like it's like a civilian kind of ish class, like I don't want people to know that I'm sitting in there. Like, I guess I've registered under different names before.
Nice.
And go take a class, and they're like, dude, why didn't you tell me? I'm like, I didn't want you to know I was in the class. Like, I wanted to learn. Like, I want to be there to learn. But yeah, so even like pistol classes, rifle classes, I go take it, and I'm always there to learn. Like that's trying to always trying to learn, and people have different opinions. Everyone's got an opinion, and so even if the instructor says something I don't agree with, I'm not going to call them out for it. Maybe at lunch or dinner that night, I might ask them how'd you come to that conclusion, or how'd you come to that? Like, so just kind of fill them out. But even sitting in the class, everybody's a student. So
yeah, I think the best instructors are not the ones who tell me to do a thing. They're the ones who explain to me why they do a thing, and that's why they teach the thing that they're teaching. I don't want to be honestly lectured by a holier than thou person. I want someone to explain to me why they do what they do and the thought process that goes into the entire thing. And again, that's with everything that I do. I don't want someone to preach. I want someone to teach.
Yeah. And, literally when we do this skinny medic trauma class, it's just a quick, like, all right, this is who I am. This is my credentials. Let's move on. And like, I want you to know that I have the credentials, but I'm not there to like throw them up and go, all right, we're going to talk about me for the next hour about how good I am.
Yeah.
Like, nope, this is it. Let's move on. And this is, you already know who I am. That's why you drove 2 days to come to my class or whatever. This is why you're doing this. So, but to kind of throw that potentials out, and I get people all the time, like, you should tell people more. I'm like, no, it's fine. Just keep going.
Yep.
But I'm there to show you, get the hands on. You do need some like data research talk, but then let's get down and dirty. Let's get the hands-on stuff. So,
oh yeah, I mean, there's absolutely knowledge out there, but you explain why you do a thing. You understand the science behind it, and I think that's the key and the important thing to do. Is know not just why to do it, or not just do it, but to know why to do it, I guess.
Definitely, but there's not a lot of people doing like civilian trauma classes. There's a couple people that I know across the country, but that's about it. Most of them are for actual first responders, like their TCCC classes or TEC classes where you have to be a first responder, but not a lot of people are doing it. So
yeah, for sure. There's a couple classes in Colorado in December, by the way.
Yes, I shared them on my Facebook page.
I saw that. I was like, oh, snap.
Yes. So if you're on the left side of the country, you can see Sean. If you're on the right side of the country, you come see me.
Boom. Got it. The next one's absolutely for you.
So how to become an EMT, or better yet, a paramedic. There again, I have a whole episode planned for this. I have a buddy of mine who actually has his own podcast. I'll just do a shameless plug for him. He has a Medic Up podcast, and him and I were partners in paramedic competition. And he does the podcast, but he's also a paramedic instructor at the local technical college. So I want to have him on and talk about this. But basically, your EMT takes about 6 months to get. It's a certificate program, and you basically learn just enough to be dangerous about being on the ambulance. And it's about 6 months. And for 6 months of education, you can come out and make some pretty good money for that. And you can drive the ambulance. You're basically supporting the paramedic that's there. Your paramedic is a 2-year program. Typically, those are going to be an associate's degree. And there again, for a 2-year degree, it's not bad money coming out doing that. You either work 12 hours or 24-hour shifts, depending on how busy of a system you are. But you're going to need like your Englishes and math, your sciences. You're going to need a lot of math, because we joked about that. I'm like, I never thought I'd use as much math as I do. And then you get your paramedic, like, oh, I got to do drug calculations. This is ridiculous. But your EMT takes about 6 months. You get half the classes in the classroom. The other half is going to be sorry, let me take that back. Erase that. Forget that. Your EMT is mostly classroom. You get a few ride times. Typically, like I think for our area, it's like 10 ride times you get, and then you're done. Your paramedic is about 50-50. You get 50% is in the classroom, and then the other half is either in a hospital doing clinical settings or riding on the ambulance. So you get a lot more hands-on with being a paramedic.
Yeah, isn't it like 40 or 50 hours for your EMT of being on the ambulance?
It's like 200 hours.
Okay.
Your first responder, like your medical responder, is about 40 to 60 hours, something like that. So
yeah.
And the EMT's 200, and then the paramedic's just ungodly. It's ridiculous.
Yeah. I have literally been looking for a while because I was really thinking about getting my EMT, not because I want to be an EMT, just because I thought that it would be another cool thing to do. And I'm kind of always one of those guys who wants to be learning something new and doing something and just figuring stuff out. But when I looked at that, yeah, now that I think about it, you're right. It was like it was like 200 hours, which is a lot of hours because I don't have a lot of hours.
Yes.
I was thinking I could definitely go to a class like 1 or 2 nights a week. And do that for 6 months, but that 200 hours, that would be so difficult for me to actually get in. And I'm like, if I can't do that part, then I would be wasting my time doing the other stuff. But it's still something I'm looking at, just trying to figure out if I can fit it in at some point.
Yeah, like most of colleges, most of your technical colleges will do like a day class or a night class, things like that. They'll kind of move it around on you. So if you're interested in all, I would go to your local technical school and talk to them, and they can kind of give you a better guide path to get where you want to.
Yeah.
Even sometimes your local services, if you go to them, like your area that you live in, say, hey, I'm really thinking about being a paramedic. Can I ride? And they will usually let a civilian ride once or twice. And you can go ride. You can go get on the ambulance and ride and decide, if this is something you really want to do.
That's actually a good point. So yeah, for me, like community college here has both day and night classes. But when I was doing my research, there was a couple online classes where you basically do all your work distance learning and just do whatever amount of hours was required for your locality on the rig at a local place, and they would help place you and stuff like that. But yeah, it is a commitment. So, and another funny thing is I know like 4 people who literally did the EMT thing, but don't do it as a living. They became an EMT and then decided that it wasn't for them afterwards. So the ride along sounds like a pretty good idea.
Yeah, it definitely happens. I've had students that took the whole class and get to the end of class going, you know what? I think I'm good. And they go do something else. They never test. They never finish out. I'm like, you just wasted 6 months of your life. At least take the stupid test.
Yep.
So, but yeah, it happens. But yeah, the ride along, like I said, go to your service, your 911 service, or the ones, your fire department, and just kind of talk to them, and hopefully they'll at least let you ride. You can talk to them, kind of do a shadow program with them.
Yeah, for sure. Improvised medical equipment that works and doesn't work.
It mostly doesn't work. Like I hate to say that, but like in our mind, we want these, like, I'm going to just improvise a stretcher out of duct tape. I'm going to improvise a tourniquet. And while it may work, I wouldn't count on it as your plan A. And I've said that plenty of videos that, yes, you can make a tourniquet out of cravats. You can make a stretcher out of some wood sticks and some rope and duct tape. Is it the best? No. But would it work in a pinch? Maybe. So plan A should be have a good commercial medical stuff ish, and know how to improvise stuff. Like know how to improvise a tourniquet, know how to make a stretcher or a litter to get someone out of the woods, things like that. But it's tough. What do you think?
Yeah, it is tough. Like I always say that today compared to me 5 years ago, if I was to come across an accident, whether a car accident or anything else out there, whether I had a medical kit or didn't, I would be better off. So I think your best improvised medical equipment is your brain, first of all. Have training, have classes, and know how to do stuff. Because then if you understand the hows and the whys, and like we just talked about looking for classes, the why you do a thing, like why do we have wide tourniquets? Understanding why that is, understanding that tissue compression is what actually shuts off the veins and arteries and things like that. And understanding, how does a windlass work, and that how is that energy transferred? And once you understand that kind of stuff, yeah, you can probably improvise something pretty good, right? Like you understand that a shoelace isn't going to occlude blood flow probably without causing massive nerve and tissue damage. But if you can wrap a shoelace around something wider and compress in that way, maybe that's going to work better. So your brain is your best improvised medical equipment. If you can figure that part out, and if you understand the why behind the science of why those things work, then you'll have a much easier job. Why do chest seals work? There's a video in the TCCC class that's a chest seal that doesn't actually look like a chest seal to me. It just looks like some kind of plastic occlusive dressing of some type. And that's an actual open pneumothorax. So I don't know. I personally don't have a ton of experience looking at improvised medical equipment like Dietrich does, but I just think if you understand the why, you could probably improvise some things that may work. But again, why go through that when you can carry an ankle medical kit or a tourniquet in your pocket or something else like that? So I don't know. It's tough. It is tough. I don't know how to answer that one really well.
Yeah, I mean, I've seen some creative ones like that. That was pretty creative. How you got that splint? How you created a splint out of a pillow or a newspaper or something like that. Like you're like, oh, that works. It's creative. Like, all right, cool. So like you said, just understanding, and some of that's trial and error. Like you're just like, all right, I'm screwed. Let's figure this out. And you start playing with different things. Like, all right, I got it to work. And sometimes you get lucky. So yeah.
Kind of look at the world with an inquisitive eye. Like I do kind of look around sometimes and I'm like, what could I make a tourniquet out of here? And I see a dozen things that I'm like, I bet you that would maybe work, possibly. Like a pin and this blue Alpha Gear flag that's on my wall. I could probably cut somebody's blood flow off at that pretty well. I actually got in one of my classes, they were talking about using Curlix as handcuffs and stuff. And we kind of.
What kind of class are you teaching?
I was taking the class, and he was like, "Yeah, you totally use it to detain people." And he walked up, and I happened to be the friggin' idiot that happened to be standing closest to the instructor. And yeah, he literally in like 1 second put it around my neck and bound up my hands and my neck to where if I moved my arms, it choked me.
Yeah,
and it was in like a second, and I was like, "Well, that's a pretty creative use of Curlix, which you wouldn't think is a thing at all, but it absolutely is." So yeah, look around the world with an inquisitive eye, understand the whys of the things we do in the March protocol. And then, if the day comes and you have to improvise something, you have a much, much better chance. I'm not going to say, look, belts are a good tourniquet, because they're just not. Could you figure out a way? Maybe. So yeah, I don't feel comfortable sharing what I think good improvised stuff would be. That mindset and kind of the critical thinking behind it, I think are your best asset.
Yeah, like we talked about before, like when we talked about the El Paso shooting, I was like, I'll be pulling shirts off the Walmart shelf. I would pull towels off the shelf for hemorrhage control, things like that. So definitely I'd be creative, pulling things off the shelf, whatever I need to do to stop the blood flow. You got to keep the red stuff on the inside. So looking around, obviously I have an ankle kit on me, but that's going to be for me or somebody, my wife or something like that. But you get the t-shirt, you get the towel I'll pull off the rack, or you get the frame that I can break to make a tourniquet out of. So improvising's there, but I would not just be prepared. And you're obviously being prepared if you're listening to this podcast. So I appreciate it.
Yeah, absolutely. And last but not least, what's the last one?
So why do most gunners not take medical training? Because it's not cool. Like, I hate to say that, but I said that to say this. It is becoming like more and more. Like 5 years ago at the NRA, nobody was talking about medical. This year, like everybody was talking about medical. Like you and I did a tourniquet demo in the middle of the showroom floor.
Yeah.
So at range day at the RAC Veteran, we did a quick down and dirty stop the bleed class, and there was standing room only from influencers, manufacturers, whoever. There was standing room only. So I think they're starting to. It's a slow process.
Yeah, and I think that the gun industry as a whole is usually 10 or 12 years kind of behind the times on new things. So for example, technology, like a lot of other industries have moved past like magazines and publications and things like that, or at least don't put as much importance on them as the gun industry does. The gun industry is always kind of behind on things. Mm-hmm. And you just said it, man, it wasn't the cool thing, but I think there's just a lack of awareness. And I think that because of the Skinny Medic YouTube channel and people watching YouTube, they're starting to realize, they're really starting to hear it on podcasts and in YouTube videos. And you go to all these events, the same events that I go to in the firearms industry, And just you being there is helping raise that awareness. And once people realize that, oh, this is important. And once they hear somebody like you say, this is important, you never know when you're going to be the first responder. That starts to kind of bleed into the zeitgeist of the gun industry. And just this podcast right here, just like raising awareness. So yeah, it's not as cool historically. But honestly, if you think about what are you going to use, your firearm or a tourniquet in your lifetime, tourniquet all the way. And I've said it on the show before that in every single class that I teach, I'm like, who here has had to shoot somebody? And I never have, maybe once I had one student, actually say that they had to shoot somebody or draw their firearm or anything like that. Like, it just doesn't happen. I also ask how many have ever known anybody or been specifically victimized by mass killing or anything. And the answer for that one has always been 0. Even in Colorado, where we've had a couple, Aurora and Columbine, and Stims, the most recent one, I personally don't know anybody that's ever been affected by that, because we see it in the news. We don't necessarily, it's not as far reaching as the news makes it seem. But how many people have seen a car accident? How many people have had to put pressure on a wound? How many people have had to do CPR or something else like that? Almost every hand goes up. So by having that understanding, and by people just honestly like Skinny Medic out there preaching the gospel of medical, I think that is what's making it come full circle. I don't think it's a failure of anything other than just the gun industry hasn't put a focus on it, and now they are.
I think so. Like, it's definitely, I mean, we've been doing the Skinny Medic thing for a long time, and it's now, like, the last few years, we go NRA and like people recognize me. They're like, "Oh, I love your channel. You're the reason why I carry a trauma kit to the range now." So that gun community, gun culture, whatever you want to call it, accepting the Skinny Medic channel into that group has been huge. Working with different influencers, different manufacturers, they're like, "Yes, we want to help you. We want to get the word out about this." So, the fact that we're not a gun channel, the Skinny Medic is not a gun channel. It's not there. We do gun reviews, and I'll tell people that we do gun reviews, but all that is to bring that guy who's looking for the Glock 48X or whatever, Glock 43 or whatever gun we've done a review on, to pull them in there going, maybe I should look at getting a trauma kit. Maybe I should watch the other videos. So we do those gun reviews to pull people in to say, you need medical training, you need good equipment at the range while you're looking at guns. And so we've pulled a bunch of people in like that. So working with different manufacturers, that it's been huge for us. And like I said, going to the same shoots you're going to, I know about guns. I'm not a gun expert. I'm not a gunsmith. But I love to shoot. I love to be around. So it's been more and more. It just continues to grow. So it's been fun to watch.
Yeah, I agree. And I think I see it every day. People are putting more focus on it. People, let's be perfectly honest, like, gun owners just don't train really. There's like a small subset that do and take it seriously. But in general, like, how many people, I can't even tell you the thousands of people that I've seen come through concealed carry classes that are probably never going to touch their gun again. They're never going to go shoot for fun. They're never going to go plink at the range. They're never going to go practice. They're going to put their gun wherever they put their gun, and they're never going to touch it again. So it's not just, why do gun owners not take medical training? Like, gun owners just don't really train.
Yeah. I mean, I had a young lady that goes to my church, and she was like, I'm really thinking about taking my concealed weapon class. I was like, that's awesome. You should. And she's like, but I'm really scared of guns. And she's like, I don't even know if I'd even carry it. And I said, well, don't get your concealed weapon. I was like, I want you to go take a class. And I gave her a few people that are local. I'm like, go take a pistol class. You can borrow one of my guns or my range. Come to the shop. We'll go shoot. And like, go take a class. Like, to say you're going to carry a firearm and not take any training is dumb. I really do. I think that's stupid because, like you said, and I agree 100%, that the odds of you pulling your weapon in your lifetime are slim. But if you draw your weapon, it's life and death. And you better make dang sure that you're going to do a good job of ending the threat, stopping the threat. So to say you're going to go buy a $500 Glock 19 You can probably get them on sale cheaper than that during Black Friday, but I think PSA's got for like $400. I think I saw that. But anyway, I scroll off. If you're going to do that, that's great. Go take a $500 pistol class, a 2-day pistol class. Go say, I'm going to take 2 pistol classes next year. I'm going to drive to wherever to go take these classes. So understand that buying the firearm and not having education is stupid. So same thing with if you're going to buy the $100 trauma kit, you need to take a class. Take a CPR class. Take a Stop the Bleed class. You may even find a Stop the Bleed class for free. So go take a class.
Yeah, 100% agree. And the people who listen to this podcast probably already know that, but I'll tell you, I'll challenge you guys right now. Go challenge some of your friends. You know, if you've got buddies that go to the range and shoot and don't take med kits, like challenge them. Be like, hey, let's go take a med class. Like, you guys have to be passionate, like the listeners. Like, we're clearly passionate about it. We live it. We talk about it all the time. We love it. We do tourniquet demonstrations and facts and firearms booth at NRA show.
Yes.
We do it. We're passionate about it. But the only thing that makes it grow is for you guys, for the people who listen to this show, to also be passionate about it. And that goes for gun training. It goes for medical training. Like, the more passionate you are, the more you can talk your buddies into going and doing something kind of out of their comfort zone, the absolute better. And I know Skinny Medic travels and teaches classes. He also does them in the South. Like, I'll travel anything. And there's a couple places that I could possibly recommend, although I haven't been there necessarily. But like Platinum 10, I know they teach some great classes out on the West Coast. Independence Training, I don't know anything about them or if they're good or not, but I see that they teach a lot of medical classes.
I know, like Spent Brass, they're in California too. He's a good dude. I took a class with him. So yeah, there's people around. It's just got to do some research.
Yep, 100% agree. That'll do it for our user question episode. Subscription boxes at Medical Gear Outfitters.
Yes, and then coupon code Civilian Medical for 10% off.
Yeah, absolutely. So basically, it's just a surprise box full of medical gear every month.
Yes, it's doing well. We're excited about them. This month, November, is tools. So as hopefully this episode comes out, you can still go get your tools. We're getting supplies ordered, ready to ship out. So the 1st of December is going to be kind of crazy for us because we have the Black Friday, Cyber Monday sale, which we'll be doing that. And then we'll be doing the subscription boxes. So actually just hired a new person to come help us at the shop. So during this crazy time.
That's awesome, man. All right, go check them out. Medical Gear Outfitters, coupon code Civilian Medical. Skinny Medic, any passing words of wisdom before we leave?
No, thank you guys. And if you guys are listening to this podcast and you have a question, go find us on Facebook or Instagram, or we like shooting our Skinny Medic, and send us a message and say, hey, this was a question. And we'll just start collecting these questions. And then every so often, we'll just pop an episode just answering questions. Yeah, I like it. It was actually it was fun. It's fun to talk about and kind of think outside the box on some of these. Definitely. All right, guys, we'll talk to you next week. Don't forget to check out the other podcasts on the Firearms Radio Network at firearmsradio.tv. And do your thing about the first responder. Oh, so you never know when you'll be the first responder. Remember the right gear and the right training. Boom.
Find us and subscribe at civmedical.com.